Hello, and thank you for joining us for our first webinar on oncology trends shaping the market today. We're so excited that you chose to join us. My name is Abby Kim, and I'm a board-certified oncology pharmacist serving the clinical strategy and innovation team at Prime Therapeutics. I have the pleasure of my colleague, Victoria Ficini, joining me as well to discuss the rising incidence of cancer in younger populations and the implications for health plans.
Thanks, Abby. I'm really excited to be here with you today and to dive into this topic.
Thanks, Victoria. At Prime, our team is dedicated to keeping our finger on the pulse of emerging trends, focusing on helping you better understand what a changing oncology landscape means for you and for your business. When thinking about these emerging oncology trends, several categories rise to the surface, including drug and spend management, precision medicine, care coordination and navigation, prevention, and value-based care. And at a more granular level, many of the emerging oncology trends within these categories that our team is following closely are listed here. Today, we'll focus on two key impacts: shifting cancer demographics and rising survivorship that are driving changes across the industry. However, we'd love to have you join us for future webinars where we will discuss the other oncology trends shown on this slide. But today, we'll talk about the rising incidence of cancer in individuals under 50 years of age, examine the clinical, financial, and psychosocial challenges these younger patients face, and then we're going to finish with some actionable strategies that health plans can think about moving forward. So let's begin by looking at how the oncology landscape has evolved over the years. Historically, cancer treatment began with surgery, chemotherapy, and sometimes radiation, really broad approaches that, while effective in most cases, often come with significant side effects. Over time, we've seen a shift to more refined strategies like targeted therapy, immunotherapy, and most recently, gene editing. These innovations have allowed us to attack cancer more precisely, minimizing off-target effects and reducing side effects. This evolution has been driven in large part by the rise of precision medicine. With the use of biomarkers and personalized treatment plans, therapies are now often tailored to the unique genetic makeup of a patient's cancer, which has significantly improved outcomes and reduced the use of unnecessary treatments. Another major advancement has been the adoption of multidisciplinary care. Today, care teams are large. They include oncologists, radiologists, pathologists, genetic counselors, social workers, nurses, pharmacists, and many other supportive care specialists, all working together to provide patient-centered care. These advances, both treatment and care team, have had a real impact. Since the early 1990s, we've seen cancer mortality rates decline by approximately 1% annually, a real testament to how far the oncology community has come. However, despite these gains, we're now facing kind of a new and concerning trend, a rising incidence of cancer, particularly in people under 50 years of age. This shift raises important questions about environmental, lifestyle, and genetic factors, and it underscores the urgency of continuing to innovate and adapt our strategies in this evolving space. So while we've made some incredible stride, we're now facing a new kind of challenge, one that's showing up earlier and in unexpected ways. Victoria, can you tell us more about the buzz that we're seeing?
Thanks, Abby. And that really sets the stage. And you're right, this trend isn't just something being discussed in academic circles or clinical settings. It's making headlines as well. We're starting to see phrases like the worrying puzzle, puzzling researchers, and shifting burden, all pointing to the fact that this trend is not yet fully understood. It's affecting people in the prime of their lives, and it's prompting a lot of questions about what's driving these changes. The tone across the board we're seeing is one of concern as well as urgency. What's especially striking is that this trend isn't confined to a single cancer type. While colorectal cancer is often highlighted, similar patterns are emerging across multiple cancer types. And in some cases, the shift is from older to younger patients, but also from men to women. This growing media attention is helping to raise public awareness, but it also underscores the need for more research, better screening strategies, and a deeper understanding of the risk factors involved. So, as we move forward, we need to think not only about how we treat cancer, but also how we detect it earlier, understand its causes, and ultimately prevent it, especially in populations we haven't traditionally considered to be high risk. So, we've seen how the landscape has evolved and the concerns around rising cancer rates, especially in younger adults, with speculation that we may be facing a national epidemic of early onset cancers. The projected trends demonstrate a clear upward trajectory in cancer incidence among adults ages 20 to 49, as shown here in the graph on the left. Based on these projections, this is really sustained, and it's showing an exponential rise over the next decade as well. At the same time, the graph on the right shows a dramatic increase in the number of cancer survivors, which is expected to nearly double by the year 2040. This is a testament to how far we've come in treatment, but this also introduces a new challenge. More survivors means more people living longer with the emotional, physical, and financial impacts that we know patients with cancer experience. These patients require more long-term monitoring, as well as more chronic care management throughout their lives. This is important for healthcare systems, as it represents a new focus to support survivorship as a distinct phase of care. So while we're seeing this sharp rise in cancer incidence among younger adults, we are also seeing more people surviving cancer and living longer with its effects. That's a huge shift in what we traditionally have thought of for managing cancer. This is a shift from treating not just a disease, but treating cancer as a long-term condition. Now let's dive deeper into what's really driving this trend. Abby is going to walk us through some of the new data that really brings the picture into focus.
Thanks, Victoria. Behind the growing concern is a study that's been making waves, not just for what it found, but for how clearly it maps out where the biggest shifts are happening. This study by Shields and colleagues in Cancer Discovery provides one of the most comprehensive analyses to date of cancer incidence trends across both early onset and older onset age groups in the United States. In this study, the researchers divided the early onset population into three distinct cohorts: ages 15 to 29, 30 to 39, and 40 to 49. This allowed them to pinpoint where the most significant increases are occurring. In the early onset group, those diagnosed between ages 15 and 49, we're seeing notable increases in melanoma, cervical, stomach, plasma cell, and bone and joint cancers. While some of these cancers, like breast, colorectal, kidney, uterine, and pancreatic, are also increasing in older adults, it's the sharp uptick among younger individuals that's raising the greatest concern. These cancers are traditionally associated with older age, and seeing them emerge earlier signals a troubling shift. And as Victoria highlighted in the headlines, we're seeing a notable shift in cancer incidence from men to women as well. This trend is especially evident among women aged 40 to 49, where overall cancer rates are rising significantly. One really striking example of this, women under 50 years of age are now being diagnosed with lung cancer at higher rates than men in the same age group, a complete reversal of historical patterns. And when we look at the major contributors, just 4 cancer types, female breast, colorectal, kidney, and uterine, account for 80% of the estimated additional cases. That's a huge concentration of burden in a relatively small number of cancer types. This data reinforces the urgency of what we discussed earlier. We're not just facing more cancer, we're facing it earlier, and we're going to be managing its consequences for much longer. Now that we've seen some of the overall trends as a broad brushstroke, let's take a closer look at those 4 cancer types that are driving the majority of this increase. Recall these 4 are colorectal, breast, uterine, and kidney, and they account for 80% of the estimated additional cancer cases. Starting with colorectal cancer, we're seeing rising incidence and mortality in adults aged 30 to 49, which has already prompted a shift in screening guidelines to begin at age 45. Yet, with early onset cancers continuing to climb, further adjustments may be necessary, especially as access and uptake of preventative screening remain challenging, as we all know. That's why it's encouraging to see promising treatment advances like those presented at the 2025 American Society of Clinical Oncology meeting just this past June. The ATOMIC trial, which studied the addition of immunotherapy, specifically atezolizumab, to standard adjuvant chemotherapy, showed improved outcomes and is setting a new standard for treating dMMR colorectal cancer. And this is a subtype more common in younger patients. While this may raise upfront costs, it could lead to better outcomes long-term and quality of life, really signaling important shifts ahead. Breast cancer is showing particularly alarming trends in the youngest age group, think 15 to 29-year-olds, where we also see incidence and mortality rising as well. Since preventative screening still begins at age 40, these cases are often detected late at more advanced stages when symptoms appear. This generally requires more aggressive and more costly treatment. Compounding this challenge, younger patients frequently encounter fragmented care pathways, which we'll discuss more in a few slides. This is where oncology case management and digital tools can be game changers, helping to streamline coordination, personalize support, and ultimately improve outcomes for this really vulnerable population. Uterine cancer incidence and mortality is increasing across all early onset cohorts. And unlike breast and colon cancer, there's currently no preventative screening method. Recent immunotherapy approvals are also transforming treatment in this space, but also driving up costs. Especially critical for these patients is integration of coverage of oncofertility counseling, which actually leads to lower long-term costs overall when these patients think about starting a family after treatment. Finally, kidney cancer is rising in adults aged 30 to 49. Although, unlike the last 3 cancers I discussed, mortality is actually decreasing. This trend is closely linked to obesity rates and incidental detection through imaging. Because mortality is decreasing and patients are living longer, survivorship planning is especially important here to ensure long-term outcomes are managed effectively. Together, these cancers highlight the complexity of the challenge. We're not just seeing more cancer, we're seeing it earlier, in more aggressive forms, and in populations that require different care models. But this leads to another question. Why is this happening in the first place? Victoria, can you tell us about possible drivers behind these rising rates?
Yeah, and there's really no single answer for this, but there are several contributing factors at play here. First, we are seeing improvements in screening and diagnostic tools. For example, breast tomosynthesis, which was first introduced in 2011. This has enhanced ability to detect breast cancer much earlier. And more recently, we've also seen updated recommendations for patients with dense breast tissue that are helping to catch cancers that might have been missed with traditional mammography. Similarly, colorectal cancer screening guidelines have now been revised to start at age 45 versus age 50. And we may also see that age drop further as early onset cases continue to rise. There are also lifestyle factors that we can hypothesize may be playing a role here. The rising rates of obesity, as well as a sedentary lifestyle, Western dietary patterns, and alcohol consumption have all been associated with increased cancer risk. In fact, obesity is a known risk factor for 7 of the cancers with rising early onset incidence. Reproductive trends may also be contributing here. We're seeing lower fertility rates and a higher average age at first birth, both of which have been linked to increased risk of certain cancers, particularly breast and uterine. And of course, genetics and epigenetics are part of the equation. Inherited mutations like BRCA and Lynch syndrome are well-established risk factors, but we're also learning more about how early life exposures may lead to epigenetic changes that increase cancer susceptibility later on in life. So, as we think about the rising incidence of cancer in younger individuals, it's critical to understand that this population faces a very different set of challenges than older adults do. From a financial and productivity standpoint, many of these patients are in the middle of building their lives. They may be in school, early in their careers, or in the workforce, and a cancer diagnosis at this stage doesn't just disrupt their health, it disrupts their education, employment, and financial stability. Many may also be raising younger children and supporting aging parents, placing them in what's been known as the sandwich generation, all while navigating their own treatment and care. Insurance could also be a hurdle here. Younger patients are more likely to be underinsured or uninsured altogether. Many could be transitioning between jobs or aging off of parental plans, which can lead to gaps in coverage. Then there is the emotional and psychosocial toll. Younger patients often require more aggressive treatment, which can be both physically and emotionally taxing. Other services may be needed, such as oncofertility counseling, which can help them preserve the option of having children after treatment. This is a critical but often overlooked need in this population. Even after treatment ends, the challenges don't. Younger survivors report higher rates of depression and anxiety, and they often face long-term economic and social consequences. So as we think about how to respond to the rise in early onset cancer, we need to design care models that reflect these realities. We need to be looking at models that are flexible, holistic, and supportive across the entire continuum of care. So now that we've gone through some of the unique needs that younger patients face as part of their cancer journey, let's take a look at some of the implications on health plans. Abby, can you walk us through what this might mean for plans?
Thanks, Victoria. You're absolutely right. Everything we have discussed so far translates directly into implications for health plans. With this rise in early onset cancers, we can expect to see a growing number of commercial and Medicaid members being diagnosed with cancer, which naturally drives up oncology spend. And when you pair that with an aging Medicare population, the financial pressure on managed care is only going to intensify in the oncology market. Another key consideration is the evolution of cancer screening guidelines, as Victoria discussed earlier. Health plans will need to stay agile, adjusting coverage policies as recommendations shift and as new technologies like multi-cancer early detection tests become FDA approved and enter the market. Early identification is really where the opportunity lies. Detecting cancer just one stage earlier can reduce treatment costs by about $50,000 per year and triple survival rates. That's a powerful case for investing in screening and early intervention, not just from a clinical perspective, but from a cost containment standpoint as well. The bar graph here illustrates this very clearly. The cost of treating colon cancer jumps from about $80,000 per year at stage 1 to almost $300,000 per year at stage 4. That's more than a threefold increase. So the earlier we catch it, the better the outcomes and the lower financial burden for all involved. Ultimately, sustainable cancer care will require a proactive, data-driven approach, one that prioritizes prevention, early detection, and personalized care strategies, really across all lines of business now. It's important to also recognize treatment patterns and survivorship looks different in younger populations, as Victoria briefly touched on. Because these patients typically aren't a part of routine screening programs, as I mentioned earlier, they often present with more advanced disease. That can mean more aggressive multimodal treatment. So think combinations of surgery, radiation, chemotherapy, targeted therapies, or experimental therapies as a part of clinical trials. This can increase clinical complexity, and it can also drive up total cost of care. We're also seeing a shift in how younger patients engage with their care. They tend to be more proactive, seeking out clinical trials, innovative treatment centers, and care environments that offer holistic support services and amenities. This creates both opportunity and challenges for health plans and providers to meet these really evolving expectations of a changing demographic. And importantly, survivorship is a growing consideration. Younger patients live longer after treatment, which means ongoing care costs, surveillance, as well as managing any potential recurrences. There can often be confusion between oncology providers and primary care providers about who owns post-treatment management. This can lead to uncoordinated or sometimes even duplicative care, which is both costly and inefficient. That's why solutions like onco primary care clinics, where oncologists and PCPs collaborate on patient care, are becoming more of a reality. We've seen several of these types of clinics pop up across the country in recent years, and they're starting to benefit patients. So we know younger patients are navigating a very different care journey. It's more complex, it's longer term, and it can be more fragmented. But the big question is, what can we actually do about it? So Victoria, what strategies can health plans start to think about, given we really all play a role in this changing demographic?
Yeah, thanks, Abby. So, first and foremost, like you mentioned, it's really early detection. This is where we can have the greatest impact before a diagnosis is made. Early detection remains our most powerful tool to improve patient outcomes and to significantly reduce cost. Health plans can play a critical role here by ensuring access to primary care, which is where preventative conversations will typically begin. Additionally, aligning screening policies with the current guidelines. We discussed today these guidelines have evolved and will continue to evolve as new data and research becomes available. Staying agile to update policies and staying familiar with these guidelines is crucial. Plans could also play a role by automating screening reminders for age and risk-based screenings and monitoring adherence to help close gaps. We could also be looking ahead as new technologies like multi-cancer early detection tests become FDA approved and be ready to evaluate these and integrate into coverage policies, especially where the clinical evidence supports improved outcomes. Another opportunity would be to invest in data analytics and artificial intelligence. Some health systems are now using AI to scan patient data in their electronic health records to flag high-risk patients and recommend appropriate early screening. Investing in predictive analytics would enable plans to identify individuals at a higher risk of cancer before they become high-cost late-stage patients. Finally, as more patients survive cancer, we need to think beyond treatment. Cancer is not a single moment of care, it's a complex journey. We can support the patient beyond diagnosis and add value by helping members navigate this system more effectively. It's important to be aware of clinical trials that may be available to patients early on in their diagnosis. And we're also seeing the importance of oncofertility counseling, especially in younger patients. And of course, a shifting focus to tackling social determinants of health, such as transportation and food insecurity, that may be barriers to care. Survivorship care is physical, emotional, and financial, and helping members access and afford follow-up care, wellness services, and surveillance can have a positive impact on quality of life, as well as reduce risk of recurrence. So to review what we've covered today, we are seeing more cancer diagnoses in people under the age of 50, with women being affected at higher rates than men. Evolving risk factors like lifestyle and genetics, as well as improved screening technologies, may all be major contributions to this shift. These younger patients bring unique complexities from finances and productivity to fertility and mental health that plans need to be aware of. And ultimately, to manage long term costs and outcomes, health plans need to prioritize early detection, embrace AI and data tools, and build patient navigation and survivorship into their oncology strategies. I want to thank you all for joining us today for our first webinar on emerging oncology trends. We hope you enjoyed this, and we hope you would tune in for our next webinar. Thank you.